The yellow fever virus has remained mostly stagnant until 2016, in which it has had a major reemergence in third world countries, such as Brazil, Angola, Congo, and so on. This could be due to multiple reasons, such as an increase in air travel, urbanization, lack of quality in healthcare or public services, environment, and climate. The resurgence of yellow fever in recent years is due to a combination of factors. A. The countries that yellow fever circulates within are typically warmer as a result of being closer to the equator, and B. The overall failure of healthcare and lack of vaccination coverage. The flavivirus pathogen contains an RNA strand known for causing human viruses that are typically transmitted through insects. After the bite of an infected mosquito, the flavivirus will first attack dendritic cells. These cells are essential to the immune system, their function being to show harmful antigens to T cells in order for them to be killed. In killing the dendritic cells, the virus can then have access to the lymph nodes, resulting in a rapid spread throughout the body. The amount of antibodies will then release antigen, toxin products, causing the liver cells to begin dying. The fever virus has three modes of transmission, classified as sylvatic, intermediate, and urban. The sylvatic mode is one that refers to the mode prevalent in tropical rainforests. This is when the virus is spread by mosquitoes feeding on non-human primates. The now infected primate will get fed on by other mosquitoes that then contract the disease, spreading it to other primates. Intermediate transmission refers to transmission that has a combination of both domestic and rural elements of living. This is most common in humid parts of Africa, in which villages are closer to tropical rainforests and therefore more vulnerable to infected mosquitoes. The urban transmission cycle is when the yellow fever virus is spread in densely populated areas and is the most common in South or Central America. These populations often have both a lack of vaccination coverage and low immunity. Epidemics in the urban cycle are often started due to an already infected person living in this area and infecting the domestic mosquitoes, which go on to breed in unsanitary containers of water, effectively creating infected larvae which will go to spread the disease to other humans in the future. The yellow fever virus will manifest in a variety of symptoms. These are categorized into three stages. The first stage is the acute stage or incubation period. This occurs 3 to 6 days after exposure to the disease, in which the infected host will start to show flu-like symptoms. The majority of the patients will enter the second stage, the remission period, in which they will recover from the disease. However, in severe cases, a patient will then enter into the third and final stage, known as the intoxication phase. During this, antibodies that are yellow fever specific will become detectable in the blood of the patient. The infected individual will begin to experience several symptoms such as hemorrhaging, vomit, muscle pain, little or dark urine, a slower heart rate, the bleeding of the anus or the mouth, delirium, and a total collapse of the kidneys and livers. This is the most severe stage and can result in a coma or death. There is no cure for the yellow fever virus, so treatment is focused on ensuring the comfortability of infected patients. This is done by maintaining the needed amount of fluids, oxygen, dialysis, and treatment of other infections through medicine. Despite there being no cure, there have been clinical trials that have potential in providing a future cure for the yellow fever virus. These trials involve proteins that are naturally released by our bodies, antiviral medication, and steroids. However, the current most effective preventative measure is the yellow fever vaccine, in which one dose can provide a lifetime of immunity. Although the yellow fever virus vaccine is the most effective current preventative measure that we have, it creates an issue for areas with a shortage of supply to a large portion of the population. The World Health Organization is working to aid this problem with the Sudan Federal Ministry, Gavi, and the Vaccine Alliance, launching a campaign known as their goals being to both increase vaccine production and availability, as well to improve the overall healthcare systems in these countries. This is done through a variety of methods, such as working with vaccine manufacturers, routine immunization, preventive mass campaigns, educational catch-up campaigns, and the maintenance of a vaccine supply. Recent sylvatic cases have been increased due to intermediate transmission. This is evident when examining the data of the victims, which shows that most of them are men who have experience working around jungles in which the Aedes aegypti circulates. And 3. The high density and lack of sanitation or adequate public services of these areas allow for the disease to be spread quickly. A possible solution for these outbreaks could be a combination of pesticides, health officials or inspectors preventing the breeding of mosquitoes on sites, the genetic modification of mosquitoes in order to make them infertile, and the most effective education. The yellow fever virus has and continues to be present in third world countries, but recently it has had a re-emergence in South America and sub-Saharan Africa, with some minor cases in Asia. Supply not meeting demand is attributed to the geographical location of these areas, their climate, and insufficient healthcare in maintaining vaccine routines from health officials. The re-emergence of yellow fever can be attributed to A. the healthcare system, B. the socio-economic class of the majority of the population, and C. the inadequate public service in urban areas. Creates a warm, humid environment ideal for the breeding of mosquitoes. An additional factor that could be attributed to the increased activity in yellow fever virus in these areas is global warming, which has caused already endemic areas to increase in temperature, thus exacerbating conditions. The deforestation of rural areas has also been connected to the increased activity in the yellow fever virus, as it A. weakens the environment, thus the food supply, which in turn are making them less resistant to the yellow fever virus. It then isolates these already weakened non-human primates into cramped areas, allowing for easier spread of disease. Reduces the blood supply for mosquitoes, making them more likely to seek out humans, as well as making humans that live near or around the forest more susceptible to mosquito bites. In conclusion, the recent yellow fever cases reflect the importance of an adequate health system, the maintenance of vaccine routines, as well as the importance of not undermining the severity of diseases, even when they are neutralized. This is especially relevant today, in which air travel, global warming, deforestation, and urbanization continue to grow, allowing for the further spread of disease.